And useful, and would it help you be a more effective practitioner? Yes, just because, you know, the class is really everything I've learned in the 16 years I've been doing this, and boiled it down to an 8-week, hour-long format. So it'll save you 16 years of practice, you know. And, you know, the more you hear this stuff over and over and over again, that's how it starts making more sense. You know, I've had the benefit of working next door to 𝗘희𝗵𝗻 all these years, so I've heard him tell me these things over and over and over again to where they finally made sense. And that's what I'm trying to share the benefit of the expertise I've been exposed to with everyone else. Well, I think what may surprise them is how beneficial this knowledge is to all your clients, not even just the ones that you're going to be doing neurofeedback training with, but I think the people that really learn the arousal model and learn to view their clients through that lens, they just become more effective therapists in general, as well as more effective neurofeedback providers. Because you just start to understand what is contributing to the person's problems and what might be effective behavioral strategies, even if you're not going to use neurofeedback, but to help them make their nervous system more functional. We're all trying to learn how to be good owners and operators of our own nervous system, because, you know, we live inside these nervous systems. That's how we experience life. And we want to make that space as compassionate and pleasant to live in as possible. And this is one of those ways to do it, is to take your nervous system to driving school or take your nervous system to yoga class, and then it's going to be more flexible and stable for you. So a lot of people, when they're first learning how to do neurofeedback, they just get overwhelmed by all the details. But they try to memorize all the details, and they're trying to anticipate every possible eventuality they could run into. And you will make yourself crazy trying to do it that way. You get really caught up in the weeds. But what helps is if you can take a step back and you can think about the overall principles and concepts, and then that helps you apply what you know. And like the framework, the conceptual framework helps you hang the details and remember the details, because you're not going to be able to anticipate everybody's background or presenting problems or brain waves or anything like that. But by learning these concepts and then putting them together with the person's narrative history, their symptom checklist, and their EEG recordings, that's what helps you come up with the protocol that's most likely to help them quickly, so that they don't get frustrated and give up before they experience the benefits of training.